Hi, Lisa.
Hi, Katie. How are you?
Good. Thanks for joining me for this interview.
My pleasure.
Um, I am a clinical and counselling psychologist in Melbourne and the general member for the Australian and New Zealand ACBS chapter. And I thought maybe I would just make a brief introduction of you before we just ask you some questions about coming to Australia in October.
That would be great.
So just by way of introduction, Dr. Lisa Coyne is the Program Director for the OCD Institute for Children and Adolescents at Maclean Hospital. So what I understand is this is an inpatient program for children and adolescents with severe OCD and anxiety.
Right. So it's actually residential. So it's not, we don't treat kids who are acute, but we treat kids who are very, very severe, who are treatment refractory. Of course, I'm going to start coughing now. And who have complex, presentations, who might have a lot of other things going on in addition to OCD. So yeah, it's a tough group of kids. They're great, really flexible, amazing, resilient group of kids with some really big struggles on their shoulders.
Yeah. And is the whole program an ACT program, or is it ACT and other things?
So it's an ACT, it's everything comes from an ACT context. So we basically, from the staff all the way down to the kids, everyone is trained in ACT, and we try to approach things in a really flexible way. And at the heart of our program is really exposure. And as you know, ACT is an exposure-based approach, so it works really, really nicely with exposure and response prevention. So we use those two approaches most particularly, and certain elements of ACT we emphasize, for example, the valuing piece, because we get a lot of kids who have comorbid depression.
Mm-hmm.
So it's really, really important to help get them moving and active in their lives and doing things that matter in order for them to be more willing to approach these really, really frightening things.
Mm-hmm. Mm-hmm. So imagine, because it's a residential program, you're really doing ACT in situ all the time in everything that kind of comes up as part of living there.
That's right. That's exactly right.
Uh-huh. Okay. And your workshop for the conference in October is fear and flexibility. So I imagine you're using a lot of what you've learned in your residential program for that workshop topic.
Absolutely.
What are you kind of hoping to convey or hoping to offer people who come?
So I think that, a couple of things. One of the things that is really important to me is to help people feel more skilled, I guess, in treating OCD and anxiety, and taking a step back and looking at it more transdiagnostically using an ACT approach. I really want to get down. So what we see is a lot of kids who are treatment failures. So these are kids who have had sort of the gold standard evidence-based approaches that are out there, and it hasn't helped. And so one of our big questions, both as a research clinic and, just in our direct care of the kids, is why? Why not? Why is it that this sort of exposure-based approach hasn't worked for these kids? And we have some really firm ideas about that, that we're both testing in our research and we're exploring clinically. And one of those theories is that kids are, we're not really good always at thinking about the function of behavior when we do exposure-based programs. And if we're not really, really on top of that, and if we don't teach the kids themselves to be on top of that, they're not able to access care well. So they can go through the motions and not really gain the benefits of it. The second thing is, exposure treatment is a really tough sell. I mean, a vast majority of people who try it won't even try and do it. And we have a number of kids who we can't even get in the door because it's just too frightening. So what we do is we use a lot of ACT pieces around that to help kids understand that, when you do this, when you face your fears, when you walk through them, first of all, you notice them as they are and not what they say they are, I guess is one way to say it. And we help connect them back into what's possible in their life, because they've lost a lot of that. Their struggle with OCD has just taken that away. And so those are some of the things that I want to get across. And I really want to get across sort of the very nitty gritty of like, how do you do this? What does this look like? I want people to leave this workshop saying, okay, I know what to do. I have, I feel like I know the skills. I know how to talk to these kids. I know what sorts of exercise and when and why to use with these kids. And if I get stuck, I know how to work with that. So I really want to help blow down the barriers for clinicians who are working with really treatment refractory kids who are really stuck, because that's our specialty. That's what we do every day. And I have to tell you, we couldn't have better kids or better teachers than these kids in our unit. They're just amazing.
So I'm imagining for people attending that work with adults that they'll probably get something out of it as well.
Absolutely. 100%. And we would welcome that, because we also work with families, and that is something that we'll be talking about. And a lot of our kids are older teens. So we, depending on who's in the workshop, I can certainly tailor the examples and the discussion to what people need. But absolutely, I would recommend it for people who are treating adults as well. Absolutely.
One of the things that you're going to be talking about in your workshop is inhibitory learning, and I think that's a concept that applies to children, adolescents and adults. It looks, from the bit that I understand about that, quite an exciting idea, especially for ACT practitioners that might have been, like me, trained in kind of a CBT habituation exposure paradigm, and it's hard to kind of figure out how that's going to fit in the ACT principles. So can you tell us a little bit about what inhibitory learning is, and if you can, in a minute,
of course,
what's exciting about it?
So what's really exciting about it is, after doing like decades of research on exposure, the field is sort of getting turned on its ear, because it's discovering through newer research that exposure doesn't always work the way we think it works, which is fascinating. So for example, people used to think that when you do exposure, the idea is to teach people to feel their emotions and then notice the emotions decrease in intensity. And the more you do that over time, that habituation is really the end goal and is the most important thing about how exposure works. What we're finding is that habituation across sessions doesn't really predict treatment outcome. And so that got people thinking, like, is our model of exposure wrong? And so to put it really simply in a minute, you never unlearn things. You never break associations between things. Those associations are always going to be there. What you can do is you can broaden that frame. So you can create new associations where people learn that situations don't necessarily mean what they think they mean, or mean what their mind tells them that they mean. So I'm sort of summarizing it from an ACT perspective. But basically, a lot of the ways that we think that you can enhance this different kind of learning, this broadening of, our associations that we have around a fear stimulus, that's something that we can use with an ACT approach. And things like teaching mindful awareness during exposure, so that people really notice not just that, am I more scared or less scared, but what else is going on in the situation. And kind of broadening that attentional focus during exposure is really, really important. Valuing contextualizes exposure. So for example, we all know that doing exposure across different environments, different situations, different people, even different moods, as we think about it, right, is very, very important for generalization. Well, what better way to promote that than have kids taking steps towards building a valued life? Because that's naturally going to bring them into all sorts of diverse situations. That's going to strengthen their learning. It's going to strengthen their ability to continue to engage in their lives rather than avoid them and do rituals and things like that. So we'll talk a lot about training, specific role modeling, or of how to coach that, how to say it, what do you, how do you do it? When do you do it? So it's really, really fun. And this is all stuff we use on a daily basis on our unit. And the kids, it's really interesting because when you talk to them, if they've been through more traditional cognitive behavioral therapy, they'll tell you, this is really different than how we learned it. This is really cool, and this is making a difference. And so we're taking that and we're putting it into research hypotheses, and we're starting to look at it from an RFT framework. So lots of really fun stuff going on. I'm so excited about it. I'm so excited to bring it to this conference and teach you guys about it. And I can't wait to send you out into the world and then have you come back and tell me, how did it work? I can't wait.
Well, thank you, Lisa. That sense of excitement is certainly catching. And I really hope when the conference program comes out, there's not any clashes with your workshop, because I'm signed up already. So you'll be glad to know it'll be sunny in Perth in October. So that will be something else that's enjoyable about coming.
So excited.
Is there any final words you want to say before we can sign off for now and see you in October?
I'm just really grateful to be coming. I'm very, very excited to bring this, all of these ideas, all of these techniques to Perth. And I really hope to see a lot of clinicians, because one of the things that drives me to do this and do these trainings is that it is heartbreaking to me to hear so many kids who do not get care that works for them when they have severe OCD and anxiety. And so this is really consistent with my value of wanting to disseminate good work. And please come. I promise you it'll be lots of fun. You're going to learn a lot, and you'll get very flexible by the end of it. Hope to see you there.
Thank you very much.
You're so welcome. Thanks, Katie.